The U.S. Department of Health and Human Services said it took the U.S. Department of Health and Human Services said it took the decision to the U.S. Department of Health and Human Services said it took the decision to due to WHO's alleged mishandling of the pandemic and inability to reform and political influence from member states. The WHO has rejected these claims, and its Director General Tedros Ghebreyesus said the withdrawal was a loss for the U.S. and the world. The organization pointed to its global efforts to combat polio, HIV/AIDS, maternal mortality, and its international treaty on tobacco control. Washington has traditionally been one of the biggest donors to the WHO, but has not paid its fees for 2024 and 2025, which has already caused huge job losses at the organization. The WHO said on Friday that the U.S. withdrawal was on the agenda for its upcoming board meeting from 2nd to 7th of February. Let's bring in Chairman, Network of Adamawa Non-Governmental Organizations, Peter Eguada, for more on this development. Mr. Eguada, thanks for joining us on the news at 10. For countries like Nigeria and states like Adamawa, WHO has been known to support immunization, disease surveillance, maternal health, and emergency response. What risks does this withdrawal pose for these programs, and how prepared are local governments and NGOs like yours to absorb or adapt to any gaps?
Well, thank you so much for having me. It's so unfortunate that the US government decided to pull off this support that it has been given to the World Health Organization globally, specifically in the northeast part of Nigeria, where we've been dealing with the issues of insurgency for over a decade and still counting. WHO has played significant role, and the role they have played has supported people in their various community, not only people who are affected by the act of insurgency, but also pandemic and opportunistic diseases, even in places where there are no conflicts. This they've continued to do for over the years until this funding cut. I can tell you, as somebody who is on ground working in communities in the northeast part of Nigeria, that the funding cut is affecting a lot of support and project implementation across the communities. Adamawa State specifically, I think WHO has been an integral part of the body policy of the health implementation policy of the state. They've supported the state in so many ways. But with this funding cut, we are feeling it as a national NGO working in the state and in the northeastern part of the country. There are no funds. That's why we are looking inwards now as we speak. Local government, the state government, the national NGOs, international NGOs, UN agencies as well, to look at what we call the localization agenda, to start building the capacity and the expertise of national actors, state actors who are based in the state and communities where we operate. But the challenges are there, but I can tell you that it's surmountable if we all agree to work in partnership with the donors. Yeah.
You know, the U.S. government says its withdrawal is based on WHO's alleged mishandling of COVID-19. It talked about political interference and failure to reform. Based on your experience in civil society and public health advocacy, how credible do you think these claims are? And where, if anywhere, does WHO genuinely need reform?
Well, I don't want to go into details of what the government of US may have laid claim to, but one thing that is certain globally is that people are asking for accountability and transparency. If the US government demands for accountability on how the funding they give to WHO or any other organization, I don't think if they are doing the right thing, they are doing the wrong thing. It's one thing to ask for accountability. It's one thing you that is given the resources to also deliver those, deliver in a transparent manner. But the question here that we're talking about, the question that we all need answers to, is that we are talking of people who are vulnerable. We're talking of humanity. We're talking of life-saving issues. People who are vulnerable in hard-to-reach locations across globe, across communities. Take, for instance, in Borno State, there are a lot of locations where you can still not access. And bodies like WHO comes with a lot of expertise. They come with a lot of resources, not just the support in terms of medication that they give, but there are a lot of competence that they have that a lot of national NGOs don't have and local public health officers may not have. So they come with this kind of support. However, countries decide to put their money where their mouth is. So maybe at this point in time, the US government may have decided, which is within their own rights, but again, as a humanitarian, I think we should look at the humanitarian principles and international humanitarian laws, what actually works for the people. Humanity should take the precedence over whatever political decision a country will take. So I think in my own purview, from the way I want to look at it, is to appeal to the US government to rescind in that decision, because it's going to affect a lot of community. It's going to affect a lot of vulnerable households, women, children, elderly people. And these are people who don't have a say or don't have a voice in decision-making process. So in that context, I think we just have to appeal to the government of US to rescind in her decision to withdraw funds for life-saving activities globally, including Nigeria.
It's also a reality check for Nigeria and the rest of Africa to begin to look inwards, like you said earlier, and prioritize funding all of these important programs. Chairman Network of Adamawa Non-Governmental Organizations, Peter Egoda, thank you for talking to us.
Thank you so much for having me.